Good morning. I'd like to share my simulation observation that I did at Roberts Wesleyan College. The simulator presenter was Laura Coles, who is a clinical instructor at Roberts Wesleyan College. She's also now the clinical director of the simulation lab. The description of the simulation scenario and debriefing. So the patient presented or experienced stroke symptoms while admitted to ED-OBS. She was actually admitted to ED-OBS after she was complaining of dizziness while in the emergency room. The sim was broken into 4 separate components, so each of the components built on the next one. So the reason they did this was that the nursing students had a chance to switch out with each other, and then they had a chance to give a nurse-to-nurse report as well. So it actually started with the clinical instructor giving a nurse-to-nurse report to the first nursing student who went in to assess the patient, and then they kind of built from there. So debriefing was completed halfway through the scenario. They kind of broke off, and then had them say what concerns they had or anything like that. And then debriefing was done final debriefing was done at the end of the scenario. Students were given 7 objectives that they needed to complete during the sim, and these objectives were provided to the students prior to coming into the sim. And then lastly, at the end of the final debriefing, students were able to express any final thoughts on how they thought the sim went, and any questions that they had. They were also given an assignment to complete upon finishing the sim, so any questions that they had pertaining to that assignment were able to be answered at that time. Observation of the effectiveness of the sim. I determined it to be an effective experience for the students. The instructors waited to the halfway point or at the end of the sim to bring up any errors that the students had made during the sim, instead of breaking out and stopping the sim at that time that they made the error. They were provided with objectives, so they understood what was expected to them. Like I said before, these were given to them in their pre-assignment. They were reviewed in the pre-briefing before the sim started, and then we reviewed them again at the end. They were given a pre-assignment to complete prior to this. So this included a review of certain medications that they determined the patient was on, along with medications that were going to be administered while doing the sim, along with skills that they needed to review. So preparation was required from the students prior to attending the sim, and the instructor did ask questions during the pre-briefing to determine whether or not they did do the preparation work. And students were given an assignment to complete at the conclusion of the sim. So they actually had a couple of assignments. One was a sheet of paper that had a patient assessment on one side, and the other side was a patient note. So they did need to do a patient assessment, and then their patient note included any interventions that they performed, along with an evaluation of the patient's care that they received. And then a graded assignment was also included in that, which was a concept map, and students were provided a grading rubric as to how to complete the concept map. Benefits of using SIM. It provides nursing students with a non-threatening environment. Therefore, if a patient error is made, it's not going to cause any catastrophic or life-threatening injury to a patient because the patient's a mannequin. It provides students with a realistic environment, so the equipment that they were provided, they had a medication cart that had medications in it. The room was basically set up like how you would see a hospital room. They're able to practice their communication skills. So this was with a multitude of individuals. So they were able to practice how to communicate with the patient. The patient was a mannequin, but one of the instructors was the one that was actually giving the answers and responses to the questions that the patients asked, which was really nice. It made it more realistic. There was also a family member in the room played by one of the instructors. So students were able to practice how to communicate with family members, which, as we know, was not always an easy thing to do. And they were also able to practice how to communicate with an interdisciplinary team, such as a healthcare provider or pharmacy, if they had any questions about change in the patient's condition or a question about a medication that needed to be administered. They were also able to build on their clinical skills. So these were senior nursing students that were in the simulation. So they were able to practice suctioning, inserting a Foley catheter, medication administration, orally and IV. So they had to demonstrate that they were able to program the pump, in assessments, including neuro assessments. Since this was a stroke patient, they were doing frequent neuro assessments. And it provides a positive, well-rounded experience. Nursing students sometimes, unfortunately, don't have the best clinical experiences. It can either be dealing with a provider or dealing with a family member. So having to make that phone call to a provider as a nursing student can be a very daunting task. you're nervous, you're not quite sure what to do. So practicing how to use that SBAR in a sim environment can be helpful so that when they do have to make a phone call to a provider, they know what it is that the provider wants to know from them for information, and they're able to make that a quick, concise phone call, which is a great way to do that.